Good morning, everyone. So I think Dr. Manoj Agrawal has already given a good opening remarks where what we are planning today. So this is presentation on behalf of Julfikar Bhutta and myself. Julfi could not be here, and it's a very odd time there. So this is the outline of presentation: school age children and young adolescent, a continuum that has been ignored. And I am going to give some facts why I say that, about facts about mortality, nutrition trends, and dailies. Then what was the evidence of impact of COVID on school age children, intervention that work, need to strengthen school health and nutrition platform, and what role pediatrician can play, and what we are planning in through IPA. So we all know about life course continuum, and there is a lot of work which has been, say done for the newborn, pregnancy, newborn, infant mortality, even under 5 mortality, but 5 to 9 years and say up to 14 years, this age group has not been. And then we have recently lot of attention on adolescent, but mostly on late adolescents. So this is the age group which is still, have not received attention somehow. And this is the age group which was affected most badly during the pandemic. And that has given us, that this age group needs attention. So there are many determinants of health, social environment determinants of health, which take a very long time, where we need a long time to act. But there are many other interventions which can be done, though there are not many studies, not much very solid evidence what are the needs of these school age children and what intervention work. But whatever is available, we can definitely do. We have to see what else is required. See, why we say these children are neglected. If you see this global age specific mortality, you can see here that this 5 to 9 year, 506,000, 10 to 14 years, 368,000. This is not as big as stillbirth, neonate, but it is really total 1 million deaths in 5 to 14 years of age, which is significant. And what is more important, if you see the graph, you can see the progress in this sector is very slow, because we have focused our full attention on reducing newborn mortality, reducing the infant mortality, reducing the under 5 mortality. But there is a significant mortality burden in this age group, which is 1 million, which we cannot be ignored. Now, if we come to the 5 causes of deaths, so here we must remember that in lower and this burden is again from the lower income countries mostly. And if you see in lower income countries, many countries, whatever are the causes of under 5 mortality, like diarrhea, pneumonia, that continues even in this after 5 years. But because we focus on under 5, we just don't focus there. But here we those are important, but there are new things which comes up: road injury, mental health. And we start focusing on mental health at quite late age, but this is the age which requires. And there are other causes like say HIV/AIDS, meningitis, tuberculosis. And as age advances, you can see you have causes related to teenage pregnancy and all that. And if this is a study from Fordell and et al., and here you can see those countries who are transitioning from Mexico, like Mexico, Brazil, have now a significant burden is from the NCD and injuries. Injuries sometimes becomes a #1 cause of the mortality. China also, you can see non-communicable diseases, and but significant numbers from injuries and communicable diseases. India is still a different story, and here we have to emphasize that it may vary from place to place, but communicable diseases do have still a significant proportion, and we should not forget they require attention even after 5 years of age. and definitely no NCD and injuries constitute a major burden. Now, if we come to the dailies, healthy life lost due to disability, here again, you can see many of the diseases which start like iron deficiency anemia, continues into the later life. And then you have other things like mental health and obesity, nutrition, and all those problems. And in 15 to 19, as I said, gynecological diseases starts. So this is now if you come to the what is the status of the intervention which work, and you see the low fruit and vegetable consumption among adolescents for 13 to 15 years. This is if you see the percentage is still very poor in countries, and particularly lower and middle income countries. And one reason is a lack of awareness, but also there are financial issues, because for these things are not accessible to them because of financial, what intervention we have accessible for the other age, other income group is not accessible to them. Same is about physical inactivity, and you can see it is still dismal in many parts of the world. And that is leading to overweight and obesity change. And you can see over the years, obesity and overweight is increasing. And COVID-19 made the things worse. We closed the school very early, and many of the countries. But as pandemic progress, almost everyone closed the school. Now we know that may not be right. That was not a right decision, and it has not helped so much. But what it has led to? It has led to the increase in anxiety, and which is increase in depression, and this is the age group 5 to 15, which has suffered most because they could not go to school, and because of the problem in family, loss of parents, mental health issue, violence, so many things. And this is how it is brought to the attention that this is the missing middle group which needs more attention. So what works? We very well know, as I said, even there are not maybe a robust data, but we know what works. In vaccine coverage, as I said, if you have these infectious diseases, you know that vaccines work. And then HPV vaccine, another vaccine, high burden, so still, and then improved detection and case management of high burden infectious diseases. We must realize that many countries like India, we still have a high burden of infectious diseases. Neglected tropical disease prevention and treatment, vast mass drug administration, and there is a lot of work going on in India on that. Non-communicable disease prevention and management, rheumatic heart disease, toxic exposure, asthma, sickle cell, epilepsy, and so many. Mental health support and promotion of positive development. This is also very, very important, and for this age group. Interventions using digital and social media platform. We know that this definitely works. Unintentional injury prevention, road safety, drowning, burns, fall, poisoning. This all does not require any rocket science, but it needs implementation and a recognition that there is an issue in this age group. Comprehensive strategies for promotion of sexual and reproductive health. We do plan for the late adolescent, but we must realize this has to start early. So these are the again from my colleague Dr. Bhutta's publication. We have to do all this, and also promoting mental health, improving access to nutritious healthy food, physical activity, and improving healthcare seeking behavior. We know these interventions work, and we have to scale this up. Comprehensive school age and adolescent health package, including education. And as you will see, we have some good example from Gujarat, India, and there is a new report which will highlight. So this is what we need to do. You know this slide shows by age group, but we have to continue what we start. We are now talking a lot about ECD and nurturing care. So whatever intervention we start, you can see that has to continue in this age, and we have to have package to deliver that. Mental health, healthy lifestyle, unintentional injury prevention, non-communicable diseases, sexual and reproductive health has to start by a quite early age. So there are many, if you talk about NC, there are many risk factors, behavior, environmental, economical, and other social determinants of health. But there are many of them are modifiable risk factors. We can do tobacco, we can definitely work on tobacco use. I have seen in my city of Gandhidham, some 9 years girl coming with somebody, and she had that gutka in mouth. And when I said, from where do you get? She just ran away. I said, everybody eats in your house and neighborhood. She said, yes. So this is really a very significant problem in not only India, but in many parts of the world. And we definitely need to do and focus on this age group. Unhealthy diet, physical inactivity. And as I said, there has to be packages using a school health platform, and also there should be something, those who are not in school, we cannot ignore them. And that is why we have said school age children. We have not only saying school health. Harmful use of alcohol, and I don't want to talk more when what age they start drinking, but that's also very, very important. We can at least sensitize them. So we have a very good framework for infants and young children nurturing care, which was released few years back. In 22, we released the adolescent and young adults for very recently in 22. But where we are missing the missing middle. And that's why we are not, when we talk about redesigning, we are just saying what starts at birth and earlier should continue, and we should find a mechanism how it is delivered. Now, what as a pediatrician can we do? What as a doctors can we do? What as a Indian Academy, Upendra will tell you what Indian Academy has an ambitious plan. What can we do? What IPA can do? First thing is recognize that school-age children and young adolescents represent a neglected and important age group, especially in lower and middle income countries. You know, when we say this, many people don't agree, but there is enough evidence for that. Appreciate that this age group was especially impacted by school closure and other family stresses during the COVID-19 pandemic. And we know that, we know that very well. Advocate to the mainstream evidence-based intervention, especially preventive care strategy among school-age children and young adolescents, deploying a school-based platform and with gender equity in mind, and also do for those who are not in school. IPA, International Pediatric Association, is in process to develop a subgroup which is led by Dr. Zulfikar Bhutta to prepare a strategy for school-age children and young adults, and will partner with WHO, UNICEF and UNESCO to roll out it globally. And as Dr. Manoj Agarwal said, also work locally. So sir, we are already there. Our heart, I live in Gujarat, my heart is for Gujarat and India, and we will definitely do in bringing the global expertise and whatever is needed for Gujarat and India. I thank Dr. Rajesh Mehta, who has helped me in preparing, and again this was a presentation from both our side, Julfi and me. Thank you so much.